All right. Good afternoon, Chelsea. My name is Dana. I am a family nurse practitioner student, and today, with your permission, we're going to do a full head to toe assessment. Okay?
Yeah.
All right. So the first thing I'm going to have you do is stand up, and right at the edge of that end there, I've already measured. You see the vision chart right there.
Mm-hmm.
I'm going to give you this, and just hold that in front of one of your eyes. It doesn't matter which one. And can you read line 7?
FELOPZD.
Okay, and can you read line 8?
DEFPOTEC.
What about line 9?
LEFODPCT.
Good, and can you read 10?
No.
Okay, well good, your vision is definitely above 20/20 in your left eye. So now switch eyes and do the same with your right eye. Start at line 8 maybe.
DEFPOTEC.
Okay. All right. Perfect. And I'll take that back from you and go ahead and have a seat on the chair again. And now I'm going to hold this about 14 inches from your face. And let's see, can you read the bottom line here?
ECTPNL.
All right, perfect. And what color is this?
Red.
And what color is this?
Green.
Good. All right, so she's got 20/20 vision in both eyes. Her near vision was good, and she had an accurate color assessment. So next, I'm just going to grab my pen light and just look at your eyes. I'm seeing that they're symmetrical, they're even. I'm not noticing any lesions or any like styes or anything like that. Her sclera's nice and white. Irises are greenish. Pupils are round and equal and symmetrical. Conjunctiva is pink and intact. All right, and I would normally assess the corneal light reflex, but I just need to verbalize that I did that. So now I'm just going to check your pupils for their reaction. So just keep looking straight ahead for me. Good. Okay, and they reacted from a 6 to about a 4, which is normal. And now I'm going to check consensual reactions. So just keep looking straight ahead for me. Good. Good. All right, and so her opposite pupil also constricted. So consensual reaction was normal. And then I'm going to check for extraocular eye movements, which is cranial nerve number 3, 4, and 6. Sorry, I had to cheat on that one. All right, so just follow my pen with your eyes, okay? Good. Okay, and so all extraocular eye movements were intact. I didn't see any nystagmus. And next, just follow the pen to your nose, okay? Okay, and that one's good. All right, and then next, I'm going to have you just look at the pen, and then look at my backyard over my shoulder. And again at the pen, and again over my shoulder. Good. Okay, so her convergence was normal and accommodation was also normal. All right, so now I've dimmed the lights as much as I possibly can. So I'm going to do, check inside your eye. Okay, so just look straight ahead for me. First, I'm checking the red light reflex. And there it is. All right, keep looking straight ahead. And I'm just going to check up the back of your eye, okay? Okay, so I see her vessels. They're intact. And I see her disc and its margins are clear. It's pink. I'm not noticing any hemorrhages or edema. I'm going to do the same over here. Just keep looking straight ahead for me. Okay, there's a red light reflex. And then again, there's our disc. It's clear, edges are clear. Vessels are intact. I'm not noticing any hemorrhages or occlusions, no papilledema. Sorry, did I blind you?
No, you're good.
Okay. And I'm going to pause to turn the lights back on. All right, now moving on, I'm going to now assess your head. So first I'm just looking, everything looks even and symmetrical. Her skin is smooth, warm, dry. I'm not noticing any scars or lesions. Can I have you pull your hair out? Or
Yeah.
no? Sorry. All right. And I'm just gonna feel here. Not feeling any lumps. I'm not seeing any flaking, dandruff. Hair is thick and evenly distributed. Again, no evidence of lice or nits. No scars, lesions, lumps or bumps. Okay. And now I'm just going to check your facial nerve. So first I'll have you close your eyes and tell me when you can feel something touching your face, okay?
Mm-hmm.
Okay, all right, so her sensory function is intact for her facial nerve, and we'll check the motor function. I'll have you clench your teeth. Okay, good. And now we're going to check cranial nerve 7, so go ahead and smile for me. Good, and frown. And then puff your cheeks out. And raise your eyebrows. Okay, great. All right, and so all of those are intact. Now I'm just going to push on your sinuses, on the maxillary here. Any pain?
Nope. Nope.
Okay, and then on the frontal, tell me if you have any pain.
Nope.
All right, and then I'm going to percuss them. Any pain?
Nope.
Any pain with that?
Nope.
Okay, good. All right, now I'm going to assess your nose. So first I want you to go ahead and breathe in on each side. Okay, now close your eyes. And can you tell me what this smells like?
Cinnamon.
Yep, good. Okay, so smelling is intact. Now I'm just going to look inside your nose, okay? Go ahead and tip your chin up for me. All right, so mucosa is intact. Her septum appears to be midline. Mucosa is pink, moist. There's a little bit of drainage present, but it's clear. I didn't notice any polyps, and her turbinates are all intact as well. Okay, Chelsea, next I'm going to assess your hearing. So what I'm going to do is stand behind you,
Okay.
and I'm going to close this ear.
Okay.
Close this ear, and I'm going to whisper 3 words, and you tell me what I'm whispering, okay?
Okay. Pizza. Purple.
Mm-hmm.
Cracker.
Okay, yep, pizza, purple, cracker. All right, and now this ear.
Cinnamon. Grass. Parrot.
Yep, good. Okay. I should have had words prepared ahead of time. All right. So next I'm going to use this tuning fork and I'm going to do the Weber and Renee tests. Okay, first I'm going to do the Weber. I'm going to strike this tuning fork and I'm going to put it on top of your head. And you tell me if you hear the sound more in your left ear, your right ear, or in the middle, okay?
My right ear.
You hear it more in your right ear? Okay. Do you have any hearing problems?
Mm.
All right, let's try it again. More in your right ear? Okay. All right, and so now I'm going to do, I'm going to test for bone conduction and air conduction. But first, well, no, we'll do this first. Okay. All right, so what I'm going to do is I'm going to strike this tuning fork and I'm going to put it behind your ear here.
Okay.
All right, you tell me when you can stop hearing it.
Okay.
And then I'm going to put it in front of your ear and you tell me if you can hear it again. Okay, ready?
I can't hear it anymore.
Okay. All right, so air conduction is greater than bone conduction on the left. And now we're going to do the same thing on the right, okay? Tell me when you can stop hearing it.
Okay, can't hear it. Yes, I can.
Okay. All right, so air conduction was greater than bone conduction on both sides. And now I'm just going to check for otitis externa and otitis media by pushing. Okay, so I'm going to push on this and pull your ears up and back. Any pain with that?
No.
Okay. And I'm going to push on the back here. Any pain here?
No.
Okay, good. All right, and now I'm going to look inside your ears. Oh, that feels awkward. Okay. All right, so I see a nice shiny tympanic membrane with a cone of light at about 6 o'clock. I see a little bit of earwax, but it's not blocking the canal. All the mucosa is pink and intact. I got a little bit of wax on my thing here. Switch to a different one. All right, and then we're going to look at the other side, okay?
Mm-hmm.
Okay, and this one has a little more wax in it, but the tympanic membrane is intact. And again, the cone of light on this one is about 4 o'clock. And nice shiny tympanic membrane. Like I said, a little bit of wax, but it's just at the outside, so definitely still normal. Okay. Okay, now I'm just putting a pair of gloves on so we can check her mouth. All right, so I'm just inspecting her lips right now. They're nice and pink, even, symmetrical. Go ahead and smile. All right, teeth are straight. Her gums look pink, moist. I'm not seeing any lesions or ulcerations. Okay, and then I don't have a tongue blade, so this is what we're using. And I'm not going to assess your gag reflex, but I'm just going to verbalize that I would assess it.
Okay.
Okay, so go ahead and open out your mouth. Stick your tongue out and say ah.
Ah.
Okay, so uvula is midline. It rises and falls with her palate. Say ah again.
Ah.
Okay, good. And her upper palate is pink and moist and intact. Her gum or her mucosa on her gums and her cheeks is pink and moist and intact. And I'm just going to kind of push down on your tongue. Stick your tongue out a little bit for me. Say ah.
Ah.
All right, I can't really see your tonsils, or the back of your throat actually. Can you stick your tongue out a little bit more? There we go. All right, so her posterior pharynx is also pink and moist. I'm not noticing any redness or drainage. And then go ahead and stick your tongue out into the thigh and then to the other side. And then can you lift it up for me? Good. So again, no lesions or ulcerations. Tongue is smooth, and her cranial nerve function is intact. Okay, so I'm gonna pause and take my gloves off. Okay, Chelsea, next I'm going to assess your neck. All right, so go ahead and turn your head to the side. Good. And to the other side. Good. And raise your shoulders up. Good. So her strength and motion is intact. Next, I'm going to check your trachea. And it's midline. I'm going to come around behind you to check your thyroid here.
Okay.
So I'm just feeling for the landmarks. Okay. All right, so there's the isthmus. And then off to the sides here are the lobes, so go ahead and swallow for me. Okay, and one more time. All right, so it rises and falls. I'm not feeling any obvious swelling or nodules on her thyroid, and it is in its proper place. All right, I'm gonna walk around here and check your lymph nodes. Okay, so we've got the preauricular lymph nodes, and then the submandibular, and then the submental, okay, and the posterior auricular, and anterior cervical, posterior cervical, and suprascapular. And I'm not feeling any obvious swelling of any lymph nodes. They're all round and mobile. Okay, and next I'm going to listen to your carotid arteries and check for what's called a bruit. And I'm going to listen with the bell and the diaphragm of my fancy new stethoscope. All right, so just breathe normal. Good. Okay. Good. All right. So her carotids are the upstroke is brisk. The rate is normal. I didn't hear any bruits, and I'm just going to feel for any thrills. Okay, I'm not feeling any thrills. Okay, next I'm going to assess her lungs, and so I'm just going to stand back here and assess the front. Looks like she's breathing about 14 breaths a minute. I don't see any increased effort in breathing. Lung expansion appears symmetrical. I'm not noticing any accessory muscle use, any obvious retractions, or any kind of labored breathing in the front. And then we'll go around here and check the back as well. And again, same thing, equal, symmetrical. I don't notice any lesions or trauma, lacerations, anything like that on her skin. Respiratory, effort is smooth, easy, and symmetrical. Okay, so next I'm going to just put my hands right here and have you say the word 99.
99.
Again, just keep saying 99.
99. 99. 99.
Right under here. Keep going.
99, 99,
Okay. Oops. Pardon the dog. Okay, keep going. Say 99.
99, 99, 99, 99, 99, 99.
Okay, good. And then I'll have you sit forward just a little bit if you can, so I can get my hands down here. And you can't really see on the video, but I've got my hands down at the base of her lungs, and they're kind of forming a W. So go ahead and take a nice breath in and out. And again. Okay, so chest expansion was equal, and then we'll do it again up here. All right, and then I also assessed her anterior to posterior ratio, and it looks like it's about 1 to 2, which is normal. I'm not noticing any concavities, any barrel chesting, or rounding. Hold on, dog needs out. Okay, sorry about that. All right, and now I'm going to percuss. Okay, so. And can you raise your arms up for me? That's a little bit easier. Okay, good. I'm going to percuss the back. Okay, all right, and everything sounded nice and resonant. I didn't notice any dullness in any of the lung fields. And now I'm going to listen. First, so just take nice, slow, deep breaths in and out through your mouth, okay? So first I'm just going to listen over your trachea, okay? Oh, hold on, I didn't flip it back over. All right. Down here. Good. All right, and on the back, nice deep breaths in and out. Okay, so lung sounds are clear in all lobes. And last, I'm going to check for egophony, and then I'm going to percuss for costovertebral angle tenderness. Okay, so just keep saying the word E, 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 E. Okay, good job. All right, and then I'm gonna do the CVA tenderness. So I'll have you just kind of either lean forward or scoot forward a little bit on the chair for me if you could, so I can get my hand back here. So I'm just feeling for the lower border of her ribs. Okay. And then I'm gonna put my hand here and tell me if you have any pain. Nope, nope. Nope. Okay, good. So negative for any costovertebral angle tenderness. And next, I'm going to check your pulses. So first, I'm going to check your carotids, not at the same time. Okay. Okay, those are nice and even at about 2+. And let's find your brachial pulses. Okay, good. Again, 2+, equal. Radial pulses. 2 plus and equal for radial pulses, and then I don't know if you can see, but I'm going to check her posterior tibial. Okay, just can you relax your feet there, and then dorsalis pedis. Okay, and those are all equal and at about a 2 plus as well. All right, so now I'm gonna pause because I need her to lie down. Okay, all right, Chelsea, now I'm just gonna listen to your heart. I'm gonna kind of come down here. Are you comfortable?
Yeah, I'm good.
Okay, you kind of look like your neck's kind of. All right, so I'm just going to feel for any kind of lifts or heaves. And any thrills. All right, I'm not feeling any, so I'm going to listen to your heart now. First, I'm going to start in the aortic area and just breathe normal, okay?
Mm-hmm.
And then the pulmonic. Herbs point. Tricuspid. And then the mitral. And then I'm going to switch to my diaphragm and go back over herbs point again to listen for any murmurs. And the tricuspid again. All right, I'm not hearing any obvious murmurs. Heart sounds are regular in all 5 areas. And then now I'm going to just find the apical, which is between 5th and 6th ribs here. Okay, and I'm going to feel for it. So that's the point of maximal impulse that I can feel. And I'm going to say it's about 2 centimeters, which is normal. All right, so now Chelsea, I'm going to have you roll over onto your left side so I can listen a couple more ways. Okay, now I'm going to just feel that again right here for that PMI. Okay, all right, good. And next we're going to move on to the abdominal assessment. And so, yep, just keep laying right there. Okay, so we'll have you go ahead and lift your shirt up for me. Yep, that's good. Okay, so I'm just inspecting first, and her abdomen looks flat, equal, smooth. I'm not noticing any obvious peristalsis. I don't see any lumps. Umbilicus is normal. I'm not seeing any obvious hernias. I do see some striae here, but that's normal after pregnancy. Not noticing any major scars, lesions, any veins that would suggest ascites or anything like that. So now I'm going to listen to your aorta up here. I'm just going to find your, there we go. Okay, good. And I'm going to listen down here for iliac or renal arteries. Then I'm just going to pull down just a little bit to listen to your femoral arteries. Okay. All right, and then I'm going to listen to bowel sounds in all of your quadrants here. Nice and active. Almost verging on hyperactive. When was the last time you ate anything?
This morning.
Oh, okay, yeah. They're almost on the verge of hyperactive, I would say. And then I'm also going to now percuss. All right, so I'm just checking for any dullness. And right here is where I felt the air bubble. And there'll be a little bit of dullness over here, over her suprapubic area. Now I'm going to come over to this side to check your liver. Okay. All right, so I'm just going to kind of start from the top down here and percuss. And then I'm going to start from the bottom up again. All right, so it's right about there is where I felt it. Okay. And then I'm going to do the scratch test over where I think the span of your liver is, okay?
Mm-hmm.
I think I need to work on this one. I don't think I'm doing this right. I need to work on that. Okay. Sorry. So now I'm going to percuss your spleen. So can you go ahead and lie on your right side? And about the mid-axillary line down here. And I'm not really feeling any dullness, so that means her spleen's not enlarged. Okay, good. You can roll back over onto your back. And I'm going to just now palpate lightly first. Tell me if you have any pain.
Nope. 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 Nope.
All right, now I'm going to go a little bit deeper, so take a deep breath in and exhale.
Nope.
And again. Okay, and again. A little more. Okay, so no pain with deep palpation. And then I'm also going to palpate, I'm not going to pull your shorts down, but I'm just going to palpate your inguinal lymph nodes here. Okay, and those are, again, I'm not noticing any swelling, nothing's tender when I touch there. And then now I'm going to do a couple specialty tests. So first I'm going to find the edge of your liver here. Okay, take a nice deep breath in and exhale. Any pain right there?
No.
Okay, so if she had gallbladder issues, there would be pain there. And then I'm going to find McBurney's point. So here's her anterior superior iliac spine, umbilicus, about right here. All right. Any pain with that?
Nope.
Okay. Any pain on the right side when I push over here?
Nope.
Okay. And so now I'm going to check for rebound tenderness. So I'm going to push down and let up real fast, and you tell me if it hurts when I let go, okay?
Nope. 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 Nope.
Okay, so that if she had pain, that would be indicative of peritonitis. And now you're already kind of have your head flexed up, but so we're going to check Brudzinski's and Koenig's. So I'm going to have you go ahead and lift your chin to your chest. And I'm not seeing her legs raise up. You can relax down. So that is Brudzinski's is negative. And Koenig's, I'm going to have you raise your knee up and then straighten it. Okay. And I'm not seeing any pain with that. We'll do it with the other knee. Straighten. All right, so Koenig's is also negative. All right, now we have her standing up to assess her musculoskeletal system. So I'm just looking at her standing there. She's got good posture. I'm inspecting the skin over her bones and joints. Everything looks intact. I'm not noticing any major lesions or scars or any deformities. I do see some discoloration in her skin here, but I'm going to say that that's probably normal for you.
Mm-hmm.
Everything looks nice and symmetrical. So I'm going to have you do some active range of motion. So first we're going to start with your head. So we're going to flex the head down and extend the neck back. So flexion and extension. Any pain with that?
No.
Okay, and then we're going to rotate it to the right. Yeah. And then rotation to the left. Any pain with that?
No.
Okay, and then we're going to do lateral bending to the right, and then lateral bend to the left. Okay, good. Any pain with any of that?
No.
All right, next we'll move on to your shoulders. Again, active range of motion, so we're going to flex your shoulders up and hold your arms out. Okay, and then all the way up. Okay, good. And then we're going to bring them down and extend them out behind you. Good. So that's flexion and extension. Now we're going to do abduction is out, and then up, and then back down. All right, and then adduction across your chest, and with the other one across your chest. Good. So that's adduction, and then we're going to lift your arms up and bend your elbows like this. So we're going to do internal rotation, and then external rotation. Okay, and then reach behind your back with one arm like you're scratching your back, and then with the other arm like you're scratching your back. All right, any pain or anything with that?
No.
All right, movement was nice and smooth. I didn't notice any limitations of her range of motion for her head and shoulders. So now we'll do spine. So we're gonna flex, bend down to touch your toes. Good, and extension, lean back. All right, and then rotation to the right, and then rotation to the left. Good, and then lateral bend to the right, and lateral bend to the left. And now we're stretched out. All right, and then I would have her turn around. You can just turn like that, and then bend over for me so I can assess for any scoliosis. Okay, so everything looks nice and even. I don't see any asymmetry, and her shoulders are back, so negative for scoliosis. Now I'm going to have you go ahead and, well, let's pause it because you're going to have to lay back down. Okay, and we've got her laying back down again. So now we're going to do some passive range of motion with your hips. And normally I would do these on both sides, but just for the sake of saving some time today, I'm just going to do the one. So first, hips we're going to flex. And can you scoot towards the side here a little bit more? And it's not really going to be a great way, but extend, just drop it down, and yeah, can't really check extension. All right, you can scoot back over. So then hips again, so we did flexion, extension, so here's abduction and adduction, okay, and then internal rotation and external rotation, okay, good. And then knees, we're going to do flex and extend, good. And then we're going to do the special test for the knees. So I'm gonna put you up like this, and it's gonna be kind of hard to do this, but I'm gonna have you just rest your knee on my, and then I'm gonna try and, okay, so that's negative. And then I'll do the anterior and posterior drawer test for ACL. All right, so that's negative for ACL tear, and then I'm going to check her MCL, so I'm going to bring it out. Or that's her LCL, sorry, that's LCL. And this would be MCL. All right, so everything looks normal for that. And then I'm going to move the camera a little bit. And then for ankles, we're going to do dorsiflexion and plantar flexion. And now we move back to sitting. Okay, now we're going to assess your strength. And again, this would be done bilaterally. So put your fists up like you're going to fight and push away from my hands. Push away from your body, I mean. Push. Okay, and pull. Pull. Okay. So strength is a 5 out of 5 for biceps and triceps. Now go ahead and put your arms out like this and try and raise your elbows up. Good. And pull them down. All right, so deltoids and lats is again 5 out of 5. Go ahead and squeeze my fingers and don't let me pull them out. Keep squeezing. All right, grip strength is strong and equal as well. And so now, again, go ahead and try and bring your knees up to the ceiling. Okay, and then have them up like that and try and pull them down. Good. All right, so glutes and iliopsoas was also 5 out of 5. Okay, and then push your feet out towards, good. Knees, flexion and extension is 5 out of 5. And then pull your toes up to the ceiling, or pull your feet up to the ceiling, to your nose. Good. And then push down like you're driving a car. Gas pedal. Good. Okay, 5 out of 5 on toes as well, dorsiflexion and plantar flexion. All right, so now we're going to check deep tendon reflexes. So first, and again, just for the sake of saving a couple minutes here, I'm just going to assess one side at a time. So first we'll do triceps. So bend your arm out like this and just let this dangle loose. Just relax, okay? Okay, that's good. And then biceps, go ahead and kind of make like you're gonna lift some weight here. Okay, now relax. Relax your arm down. There we go. All right, so positive biceps. And then the hard one, the brachioradialis. Oh, it worked. Okay, now I'm going to check your patellar. So can you sit back in the chair so your legs are dangling? All right, and then patellar. Oh, you're pretty, yeah, pretty hyper reflexive there. Okay, let's check the other side. Okay, and now I'm going to check your Achilles. Good. And it's going to be kind of hard to see on the video, but I'm going to check your Babinski. Okay, this might tickle a little bit. All right, and she had, normal Babinski reflex as well. So next, I'm going to check cerebellar testing. So we're going to have you on your hands on your thighs. Just go like this, back and forth as fast as you can. Okay, good. Now thumb to all your fingers as fast as you can. Good. All right, so speed was fast and rhythm was nice and smooth and equal. Now with your right leg, take it to your left knee, put your heel on your left knee like that, and then just slide it all the way down to your ankle, and then back up. And then the same thing with your other side at your knee, slide it down and back up. All right, and now I'm just gonna have you get up and like walk to the air conditioner and back, if you could please. All right. So no issues observed with her gait. Her arms were swinging appropriately. It was balanced and symmetrical. And so now we'll try tandem walking. So let me move this maybe over here. We'll just walk to the plant and back. So heel to toe, like they show the cops doing on TV.
Okay.
All right, all the way to the plant and back. Okay, Chelsea hasn't been drinking today. Okay, good. And then walk on your tippy toes to the plant and back. And I'm not observing any issues with gait or balance with that. And then can you walk on your heels to the plant and back? Perfect. Okay, and then maybe take a couple steps back there. And last, we're gonna do the Romberg test. So we're gonna start off first with your eyes open, just kind of cross your arms across your chest like that. And we're just gonna stand here for about 20 seconds. And feet together, perfect. And I'm not observing any swaying. She's not taking any steps. She's not falling. I probably should stand by her for this in case she does fall. Watch out, Charlie. Okay, we're at 10 seconds. All right, you don't feel dizzy, not having any balance issues.
Nope.
All right, so now go ahead and relax your arms down, shake it off. And then same thing, hands across your chest and close your eyes. Feet together, and for 20 seconds for that. And again, I'm not seeing any obvious swaying. She's not falling, stumbling. Balance is maintained. Posture is good. All right, we'll call that good. All right, thank you so much,
Yes.
Chelsea, for being such a wonderful patient. I
You're welcome.
appreciate it. And that is it.